Data shows that children are the least affected when it comes to COVID-19. But now a mysterious illness linked to COVID-19 seems to be affecting children across the world, sparking concern. Cases of this rare illness were first reported in the UK, Italy and Spain. Britain's National Health Service first raised an alert last month.
We have become aware in the last few days of reports of severe illness in children, which might be a Kawasaki-like disease. So Kawasaki disease is a very rare inflammatory condition that occurs in children. The cause is not often known. It can be related to a number of things.
Experts in Italy also remain concerned by this rare syndrome. Take a listen in.
We have been told that in the areas, in the regions of Italy in which there's been a higher prevalence of COVID-19 infection, the pediatricians have seen an unexpected increase in the cases of Kawasaki disease in children.
France has also reported several cases of this mysterious illness. The French health minister mentioned that there were more than a dozen cases of children with inflammation around the heart, but some of the children have tested positive for COVID-19 while most have not. That's not all. Examples of such cases are also now emerging in India. Reports say that a 4-month-old child in Kolkata with symptoms similar to the Kawasaki disease has now also tested positive for COVID-19. The symptoms developed are similar to the Kawasaki disease or toxic shock syndrome in a lot of the cases. Kawasaki disease is a mysterious illness that primarily affects children up to the age of 5. It causes the walls of arteries to become inflamed, resulting in fever and joint pain. Now, all of these sound quite severe, but most recover without serious issues from the Kawasaki disease. But with this new illness, some critically affected children are ending up in intensive care units with shock-like symptoms. New York has witnessed its first death from this rare illness linked to COVID-19. A 5-year-old boy in New York has died from this inflammatory illness. Health officials are also investigating 73 similar cases reported across New York. All of these children exhibited symptoms similar to Kawasaki disease when infected by COVID-19.
But while rare, we're seeing some cases where children affected with the COVID virus can become ill with symptoms similar to the Kawasaki disease or toxic shock-like syndrome that literally causes inflammation in their blood vessels. This past Thursday, a 5-year-old boy passed away from COVID-related complications, and the State Department of Health is investigating several other cases.
So how exactly is this illness linked to COVID-19, similar to the Kawasaki disease? Some of the symptoms of both the diseases or conditions overlap in children, but the mysterious illness in COVID-19 patients causes severe abdominal pain, nausea, and vomiting as compared to the Kawasaki disease. The Kawasaki disease also majorly impacts heart vessels. But in the COVID-19 associated illness, only a few cases describe any vessel inflammation. The age bracket we're talking about among the children affected by this mysterious illness is also not typical of the Kawasaki disease. Many children infected by this illness are above the age of 5. As more and more children now show the symptoms of this illness, it highlights the need for parents and health experts around the world to be all the more vigilant. Scientists are still trying to determine whether this mysterious disease is indeed linked with the coronavirus alone. This comes as some children who have the illness have not even tested positive for COVID-19.